mental health. And you think that's kind of weird. Why is that? Well, part of the problem of mental health is dealing with how you feel. So people who have poor mental health, when they're not able to focus and they're not able to think about things and they're not able to consciously make choices, then they're going to make choices by how they feel. And unfortunately, how we feel is not always the best thing for us. And so if you feel like eating chocolate all day long, then and you're mentally ill, then that's what you do. You eat chocolate all day long, and you don't. Your brain doesn't go, oh, you know what? That's not really good for me, so I'm not going to do that.
Hello, everyone. Welcome to the Healthy Heart webinar. We're getting live here, getting all set up. We've got the three of us today. Actually, I better change my view so you can see all three of us. Cheryl, Dr. Saunders, and myself. Welcome. Welcome to the party, guys. Say hello. Let us know where you're tuning in from. Some of you might have been on here with us yesterday where we talked about type 2, and that was a really good webinar. If you weren't able to catch that, you can watch it on Facebook or it will go up on our YouTube channel. But Barton Webinar is our hub for our webinar, so you can head there. You will find a link to our YouTube channel where you can catch all of these past webinars. And I think we're in the 20s on this webinar. So we've been doing I can't believe how fast this has gone. It seems like we just started these Healthy Heart webinars like last week. So this is exciting. We've learned a lot. We have covered a lot of topics. I feel like I have a whole new appreciation for the heart, brand new education. I feel like I just took my 100 through 300 courses learning about the heart. And it was sure fun. So now we're going to dig in deeper. We're going deeper. We're going to talk.
Sometimes you say you're a doctor, Leslie. You're like, I'm
pretty much.
I know everything, and you're pretty much between diabetes and heart health.
Yeah. I always say, and I watch Call the Midwife, so I can also do deliveries now. If you have a problem with your delivery, I know what to do. So
we'll give you an honorary doctorate degree. There you go.
Oh, that's terrible. That's like saying I'm a doctor because I watch Grey's Anatomy. Actually, you know what though? I do feel like I have learned a lot from these webinars. I'm not going to be able to do surgery, but I feel like I can at least point you to the right person who would know the answer. And I think that is just as powerful. So
I'm not a doctor, but I saw one on TV once.
Yes. Right. I'm not a doctor, but I do know Dr. Saunders' phone number and it's in my phone. So that's about the same.
We have Kathy and Eric on from Minnesota. Hello, family.
Hey, that's fun. How are you guys?
Kelly too. Hello, and Anders. Some people we recognize. Also, Fred and Jean Unger from snowy Steamboat Springs.
Oh, they're still on vacation. Oh, it's snowing. So it was raining yesterday.
Snowing. Wow.
Well, welcome back. Thanks for hanging out with us on your vacation. You guys are hardcore now. That's awesome. Nice work. But see, there's never a time where you shouldn't learn about your health, right? That's why we're here. We want to learn how to take care of our bodies. We want to pick Dr. Saunders' brain and figure out all of the things that he's been researching so that we don't have to research it. That's not true. I think it's good to get in there and learn for yourself. I love that Dr. Saunders just kind of sparks that in all of us. He helps encourage us to seek out our own answers and our own health and just take control of our own health. So we're going to dig in today. It's going to be an important topic because we're going to be talking about mental health and the heart. And so there's a lot to cover there and very timely. Also, I believe this is Mental Health Awareness Month.
Is that correct? There was a day, Mental Health Awareness Day.
Okay. So it was recent, but this is going to be really good. So before we get started, I just want to put a disclaimer out there that Dr. Saunders is not your personal doctor. And the things that we are sharing today are for general purposes only. So please consult your healthcare professional before implementing any of the things that we discussed today. We also want to mention that if you have questions that come up as we go, use the Q&A. If you're on Zoom, that's kind of the best place for us to manage those questions. Facebook, YouTubers, you're welcome to comment as well. We'll try to do our best to get to those. YouTube, you're actually watching the replay of this, but no worries. It's important. You're watching it at the exact time you should be watching it. And so if you want to comment there, again, we'll see if we can answer. But what I would really recommend that you do, if you want to talk further about this, go to Barton Webinar on Facebook, because that is a private group for all of you who watch our webinars. You can chat among yourselves and share ideas and thoughts and all of that, because there are a lot of people here who will have great ideas for you and they'd love to share. And you probably have ideas for them too. So use that as your community and just a great resource. Lots of people hopping on here. We have some people from Texas. Larry, I don't know if you had mentioned Larry yet. Terry, Gail, Delbert's on. Let's see, Bertha, the Garcias are back. How are you guys? Doyle, hi from South Dakota. Hey, I'm in South Dakota too. Welcome. You know what? I'll just ask this question. It says, is nitric oxide good for the arteries?
Nitric oxide is very important for the arteries. Nitric oxide is what dilates the arteries and allows blood to flow into certain areas. And nitric oxide is, it works locally. And so it can dilate the blood vessels in this area, but not affect the ones in another area. So it doesn't just like dilate all your blood vessels. It dilates, the area that needs it. And so that's where the advantage of nitric oxide comes in for people that have a vascular disease, people that have things like fibromyalgia. Fibromyalgia is just a diminished blood flow to some area of the body, and then it gets painful because you start building up lactic acid because there's not enough blood flow, you don't have enough oxygen. So things aren't functioning right. You get pain, you get cramps, and it's tender to touch. And then nitric oxide dilates the blood vessels, allows the blood to flow in there, clean out all the lactic acid, stop all the cramps, get oxygen to the tissues, get energy back in the muscles, and everything starts functioning again. The pain goes away completely. So yeah, nitric oxide is really important.
Very interesting.
How do you get nitric oxide then?
Yeah, okay. So that's the excellent second question is, how do you get it? Nitric oxide is made in your body from an amino acid called L-arginine. It's pretty unusual and rare for people to have a deficiency in L-arginine, but I have seen people that buy supplements, the nitric oxide releaser, whatever it is, just like a whole lot of L-arginine and citrulline, which are the amino acids that are used to make this nitric oxide. But having more arginine doesn't necessarily mean you're going to make more nitric oxide. It just means having enough will allow you to make nitric oxide when you need it. You also have to have the other factors that are involved. If you're under a lot of stress, you make less nitric oxide. If you have a lot of inflammation, you make less nitric oxide. So getting rid of the inflammation, having enough omega-3 oils we talked about last time, that's really important too. So yeah, arginine.
All right, guys, we're going to dig into today's topic about mental health. And I just kind of want to get an understanding for everyone. What do we mean? I feel like mental health is thrown around a lot, just the words. What is it? What does mental health mean?
Mental health, if you're mentally healthy means you're mentally mature. And mature means like independent, like you can think for yourself. When you are mentally dependent in some way, that's poor mental health. And but if you think about it, a lot of it is just potentially like delayed development. It's perfectly normal for a 1-year-old to have attention deficit disorder. You can't expect a 1-year-old to pay attention for a half an hour to anything. That's not what they do. They're not mentally healthy that way. So they have ADHD, and they just jump around and run around like a 2-year-old, same thing. But by the time a child gets to be in the 5, 6, 7, 8 range, you kind of expect them to be able to listen, and to pay attention, and pay attention meaning they can not just stay in one place, but actually focus and absorb information, and listen. So that's a developmental kind of thing, something like ADHD, ADD. And then other things like you expect, it's okay for children to have imaginary friends, for example, and things that they talk about, and they play imaginary games and stuff like that. But by the time somebody's in their, preteen range, you expect that they're going to be more able to manage their own and understand what's going on in the world around them, and be more connected to the world around them. And so the way to look at mental health, I think that the best way to look at mental health is not to say, "Oh, you're demented, you're horrible, you're mentally ill." Is really to look at what level are you mentally functioning, because it's really levels, and mentally is the brain's ability to pay attention, to focus, to learn, and to connect with other people, and to use information, and to be able to seek information, which is part of learning. So the ability depends on where the development is. So some people are developmentally delayed. So if somebody who's 30 years old says, "I have ADHD," and you say, "Oh, that's a typical 2, 3, 4-year-old kind of thing," and so then you kind of know what to do. The next step is then oh, you need to grow up. And the way you grow up is the same way everybody grows up. It's practicing. You learn to become independent by practicing. A lot of times the problems that we have in medicine is that we keep people dependent. So if you're a dependent child and you're not able to think for yourself, then we make you dependent on medications. I had somebody recently who went to the doctor. He was, his wife actually told him that he had to go to a psychiatrist because she said he was bipolar. Well, the psychiatrist said, "No, you have ADHD. Here, take an amphetamine," and gave him an amphetamine to take. And it really didn't help his problem. And so when he came in to see me, I discussed it on an entirely different level. So these episodes that you're having are where you don't have control over what you're feeling, and so you don't control what you do. And so how do we regain control of that? How do we get to the point where you can grow up and be in control of what you're feeling, what you're thinking, and what you're doing? And so our discussion was on a totally different level than a psychiatrist's discussion would be. So that's the way to think about mental health, is where are you? Then if you think about heart disease, you say, then why was, when they did the in England, they did an artificial intelligence analysis of 400,000 people and said, okay, what are the real risk factors for heart disease? And it was like totally different than anything you've ever heard. Cholesterol didn't even show up on the list. It was like number 46 out of 48 or something like that. And blood pressure didn't show up on the list. And so what are the real risk factors for heart disease? Well, they came up with socioeconomic status was a big one. Mental health was like number 4 on the list. Atrial fibrillation was, of course, on the list because you already have heart disease. That's what that is. And so most of them were kind of lifestyle factors. But mental health was something that wasn't a lifestyle factor. It was mental health. And you think that's kind of weird. Why is that? Well, part of the problem of mental health is dealing with how you feel. So people who have poor mental health, when they're not able to focus and they're not able to think about things, and they're not able to consciously make choices, then they're going to make choices by how they feel. And unfortunately, how we feel is not always the best thing for us. And so if you feel like eating chocolate all day long, then and you're mentally ill, then that's what you do. You eat chocolate all day long, and you don't. Your brain doesn't go, oh, you know what? That's not really good for me, so I'm not going to do that. If you feel like smoking, then that's what you're going to do. You're going to smoke. If you feel like drinking, you're going to drink. So people who are mentally ill often have these lifestyle issues because of how they feel. They're just dealing with their feelings, and so even though the term mental illness is used in that AI study from England, it's really I think underneath that, I think the real issues are lifestyle issues, and that is just doing what you feel like doing instead of thinking about it and going, oh, I'm going to choose to do something that's good for me instead of just I feel like this, therefore I'm going to do that. Isn't that interesting?
Yeah, that is interesting. I know there's a lot of discussion about my husband and I were actually just talking about this. Many people that we know are using anxiety meds. There just seems like there's a lot of people that are dealing with anxiety now, lots of depression. We just keep hearing more and more about this as really a pandemic. And I think it'd be good to just dig into that a little bit further too. What's going on? Why is this so prevalent now when it wasn't, as much years ago? And what is actually happening in the body when we're dealing with these things?
Good questions.
Good questions. Okay, so anxiety. Anxiety is the sense of not being stable. It's not having a foundation. So anytime the brain is dysfunctional, then anxiety is part of that. So for example, when somebody has a stroke, and before these are people who were active, alert, very competent people, and they have a stroke, and all of a sudden something doesn't work. And what do they get? Anxiety is one of the main things they get. So this sense of not being stable is where anxiety comes from. It's a fear of the future, a fear of what's going to happen, that I don't know what's going to happen, and not having stability and not having a hope for the future, so to speak. So in one sense, you can look at it as a spiritual illness, that people who have anxiety don't have hope for the future. They don't have a sense of things are going to be okay, that everything is in God's hands. That kind of sense is what gets rid of anxiety. And if you look at what Jesus said, he talked a lot about that. Don't let your heart be troubled, and don't be afraid. Fear not. Comes up a lot. You know what? It's okay. If people don't feel that, if they feel unsteady, if they say, "Oh my gosh, I had a patient that was freaking out because Trump was president," and she said, "The world is going to go to hell, and we're not going to survive these 4 years." So the entire time Trump was in office, she was a basket case, and she was calling me all the time. And the really interesting thing is she's a PhD licensed psychologist.
Wow.
And she was just really anxious. Why the anxiety? Well, because she felt unstable, because she didn't think that the president was able to handle the problems of our country. And so she said, this is going to end horribly. And so she felt very anxious. So having that's where anxiety comes from, is that sense of not having stability of some kind. Depression is a different issue. Depression is kind of similar in that the depression means lack of hope. when you don't have hope for the future. And most of the time, depression comes from a hope that we have, an internal hope that we have of, I'm going to be able to get my needs met. I'm going to be able to get what I need. I'm going to be able to take care of myself. It's a hope that that I will have, that I will be able to accomplish what I need to accomplish in life. That these are on my bucket list, and I am able to do those, and that's hope in your life. As soon as you come to the point of I can never get what I want, I'll never have what I want, I'll never be able to get that, I'll never be able to go there, I'll never, that sense of hopelessness brings depression. And most of the time that comes from what we term a broken heart. And the heart is what you desire, what you need, what you really want, and what drives you. It's the heart is what gives you the impetus to go and do things, and your heart has desires and needs. If you come to a point when your heart is broken and you say, I've lost everything, I have my heart set on that and it's gone. That is a broken heart. And then that results often in depression. People who don't have hope for something better, people who don't have hope for anything else in their heart, then they get depressed. And I'm feeling depressed just talking about it. It gets me like I'm so sad for the people that have a broken heart. And so when people come into my office with anxiety, I ask them, okay, what is stable in your life and why do you feel unstable? And when people come in with depression, I tell them, well, what is your hope? What is that in your heart that's broken, that's lost, that you have no hope of regaining, that you have no hope of getting? And in dealing with those specific issues, people often come to, oh, that I had in my heart, I had hoped that someone who got a divorce, for example, when I talked to her, I had hoped that, my husband would fill my need for connection, that I would have that connection. And now he's gone. And I've just been so depressed ever since. And I haven't been able to function. And because there's no heart, no impetus to move forward, because, the heart's broken and there's no motivation anymore in life. People go to motivational seminars and rah, 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 and they're missing the point. The point is that the heart is the motivator. So then she and I talked over a period of time about what kinds of things that she could do, or what ways she could fill that need for connection, how she could make connections that would fill that need in her heart. And she got hope again, and she started having some motivation to move forward and move forward in life. So yeah, anxiety and depression, they're really big. And for heart disease, guess what? Reality is people do die of a broken heart. People do get heart attacks from a broken heart. It's a real thing. And it's not even something that's just in the mental health arena. You go to cardiologists and they test the heart. And I actually had a patient come in last week, and she said that she was having this chest pain, crushing chest pain. She went to the hospital. They go, oh my gosh, we got to send you down to the specialty hospital, send her to specialty hospital. And they did all the catheter in her heart and all that stuff, all the heart tests. And they came back to her and they said, well, you have a broken heart. And it's an emotional thing that you have to deal with, because what happens is actually the blood vessels constrict from the stress. Stress causes a release of adrenaline and cortisol. Adrenaline, norepinephrine cause constriction of blood vessels. And it can specifically happen in the heart. And when it does, when those blood vessels constrict, you could stop the blood flow to the heart and literally have a heart attack from a broken heart. So it's not a minor thing. You dealing with it, depression and anxiety is a very important thing. And that's probably the other reason, besides the lifestyle issues, that mental illness is in the top 10 causes of heart disease.
Wow. I'm going to kind of switch this a little bit because I'm curious about the way that foods affect your body to give you anxiety. For example, I know that if I drink like 3 cups of coffee, I will have anxiety. And yeah, or I have a friend that if she eats gluten, she experiences extreme anxiety. And so I know that there are other things that can play effect into those. I hear people say, depression's hereditary in my family. We all just get it. What are your thoughts about that? And then I'm also going to ask, how do hormones affect these things? How do deficiencies in nutrients affect these things?
So many questions.
I know. So whatever you feel like tackling.
No, these are big, and each thing that you mentioned is actually really important. So food affects how you feel in a big way. Some people, eating sugar actually stimulates the adrenal glands. People who have excess adrenal are going to feel more stimulated, and they're more likely to get anxiety from sugar. And that's just sugar. Caffeine, of course, same thing. Caffeine, the way it works is by suppressing a calming hormone, so you don't feel calm, so you're kind of wired, and so it prevents you from being calm. Is why the caffeine has the wake up effect, is to block the calmness. Well, if that calmness is what's keeping you from being wired and anxious, then the caffeine's going to release that anxiety. And but you know what? Caffeine's not bad for you. It's just that some people have that effect from it. And if you have that effect from it, then yeah, avoid caffeine. That's not a bad thing. So, but other foods, like things that you're sensitive to or allergic to or having reactions to, things like gluten that can cause a reaction. So when you have a reaction in your body, like inflammation, the brain is affected by that. And the effect on the brain often brings anxiety. That's a common thing when you feel unbalanced or out of balance, or you don't have a firm foundation, or you can't think clearly, then anxiety is often a result. So anxiety can often be a secondary to that, to whatever foods you're eating that you're reacting to. Yeah. What else? What was the other question?
Hormones was another one.
Oh yeah, hormones. Yeah, hormones.
Agreed,
big.
Dr.
Okay.
Saunders. Agreed. Hormones.
When I was in medical school, we were specifically told in lectures that menopause had nothing to do with anxiety, that was not even an issue. And then I get into practice in residency, and I'm seeing all these women who are going through menopause, and they start getting anxious, and they go, no, I've never been anxious before. This just started coming on a few years ago or something like that. And so I read about other doctors that have said, yeah, you know what? We've been seeing a lot of anxiety from in these menopausal women. So now, 30 years later, they're saying, oh yeah, hormones have a big effect on anxiety. Progesterone just by itself. So from age roughly 35 on, women's progesterone levels kind of gradually decline. And they're not like a steady decline. It's like, they're like this. But the overall, there's a decline from about age 35 to 40 on. So, and progesterone is a calming hormone. It gives you and it goes into your liver and is made into allopregnanolone, which is a sedative. So this is the sedating, calming effect of progesterone. And so so it's kind of like caffeine. You take away the progesterone, or you decline in progesterone, and you lose the calming effect. And it's like, I'm wired. I can't sleep at night. And because I can't sleep, I'm wired and tired at the same time. And I can't function. I can't think straight, and all these issues. So mental health our hormones can have a big effect on mental health. And estrogen does, progesterone, testosterone, cortisol, of course, does. and then all of the adrenaline, epinephrine, norepinephrine. They all have big effects on your mental health.
I was going to say, I'm at that age where changes are happening. And for a few years, I'd be waking up in the middle of the night. Oh my gosh, someone's breaking into the house. Oh my gosh, I hear noises. I was never fearful in my life, except in the middle of the night, I'd wake up afraid that we're going to be destroyed by some incoming forces. Got checked. My progesterone was too low. Took the progesterone and that went away. So it was anxiety in the middle of the night, not sleeping. So testify to that, doctors.
Wow. Wow. Cool. Yeah.
Also, just thinking through low levels of certain nutrients, how that might affect someone.
Yeah, nutrients have a large effect on a lot of different things in the body. So energy production is going to affect how you feel. People who feel fatigued and slow and I can't function, sometimes they're not making energy. If people are often given thyroid, the number one medication given in the world is thyroid. But about 50% of those people really don't have a thyroid issue. They have an energy issue for a different reason. And sometimes it's the adrenal glands and sometimes it's a nutrient. So you ask about nutrients, and yeah, if your vitamin B12 levels are low, then you're not going to be making energy very well. But the other thing is you're not going to be making neurotransmitters very well. And those are the chemicals that your brain is talking, all the brain cells are talking to each other through these chemicals. And if you don't have enough of the nutrients to make the right ones or enough of the right ones, then you have imbalances. And then you have a whole bunch of stimulation and not enough calming effect. And then you're like, wired, or the other way around, there's too much calming and you're like, I can't function. You need balance in these things, and having this sufficient supply of nutrients, especially B vitamins. B vitamins most of them are very important in the production of those neurotransmitters where the nerve cells talk to each other.
How about vitamin D? I'm in South Dakota. We're about to enter our 6 months of no sun. Well, that's not true. We do get sun, but it's harder to go outside and sit in it. What role does vitamin D play in our mental health? And the sun.
Well, yeah, because vitamin D, the sunshine vitamin, and half of the effect is the sunshine itself, and the other half is the vitamin D. Vitamin D helps you use sugar more efficiently. Vitamin D is actually a steroid hormone. It's not really a vitamin because you can make it in your body, and it's still called a vitamin because you require something external. You have to have sunshine or you can't make it. So you can't really make it all internally. You have to have that sunshine. So vitamin D affects energy production, but the steroid hormone, every cell in your body has receptors for vitamin D. So it affects how your body functions in a very general way. It affects how your immune system functions. As far as that goes, there are people who live in areas. I have a brother who used to live in Forks, Washington, which if you ever read the Twilight series, that's where it was. And they get maybe 100 days of sun a year. I mean, it's like, the Olympic rainforest. It's a rainforest and it rains like, I don't know, 200 days a year plus or something like that. So my brother got severe depression because of that. He had to move to Boise, Idaho, to get into the sunshine, where he's doing a lot better. So the sunshine, vitamin D, they're actually really important for how you feel.
And then what do you think about people who say, my mother suffered from depression and my grandmother, so that's why I'm suffering too? Is that a thing?
That is a thing. People have enzymes in the body that make like the neurotransmitters that the brain talks to each other. I have a child that that I saw yesterday. He's 9 years old and he is constantly wired. He's like, we did some genetic tests and everything. We found out that he's missing an enzyme called MAOA, monoamine oxidase type A. And because of that, he can't break down those neurotransmitters. So they build up to high levels. And so he's got this constant stim. And so he gets overstimulated really easily and even gets aggressive and attacks his parents. And so it's interesting. I was talking to the doctor of the family, the primary care doctor, and she said, I'll bet his dad has that issue too. And one of his sisters, he has it worse. But yes, it does run in families. Those enzymes, the genes that make those enzymes are passed down from family to family. So one of the things that I do is I ask about, in your family, is this a common thing? And if it is, then I'll do genetic testing and looking at the genes. I'll be able to say, well, if we can find out what your problem is genetically, then we can fix generations, both, maybe your mom or dad or aunts or uncles or whatever, or cousins or your children or your grandchildren. And, so knowing one can often help you to know what to do for a lot of other family members.
And
What
then
about,
but
I was going to say, what about OCD in health? That's another kind of mental health disorder that's talked a lot about besides anxiety and depression. Is there a relation to having OCD in your heart?
Yeah, OCD specifically for the heart, I don't know the connection, but OCD is a form of anxiety. When the brain isn't functioning well, when people don't feel stable, when they're feeling unsteady, they try to grab onto things and they become obsessive about this, and they can focus on this because I can't control all these other things. So I'm going to control this one thing in my life and I'm going to totally control it. I'm going to overdo it. and that's where the obsessions and the compulsions come from, is really from anxiety, a lack of control.
And then let's chat a little bit about, what does exercise actually do for our mental health? How is that playing a role into this?
Oh, wow. Exercise is so important. Exercise does so many things. It helps you build mitochondria so you have energy. Energy is really important. Energy is what allows you to function, allows everything to function, allows you to make the proteins and the enzymes and everything you need in your body. It's not just like, energy isn't just for thinking and running a marathon. Every little chemistry reaction that happens in your body, not everyone, most of them require energy at some point. So in order for everything to function right, you got to get energy. Well, exercise allows you to produce mitochondria to make energy. And that's where energy comes from. If you're laying around on the couch, you're going to get fewer and fewer mitochondria and less energy. And the functionality of all of your cells declines because of that. So exercise does that. Another thing exercise does is release endorphins. Endorphins are wonderful hormones. And all of you have heard of addiction to heroin, right? Heroin is like, wow, this amazing stuff. Well, guess what? Your body makes heroin, and you can get heroin anytime you want. I had a woman who was hooked on heroin. She was like injecting heroin for 20 years, more than 20 years. And she wanted to get off it. And I tried to help her and I couldn't help her. And one day I saw her, it was like a year later, and she was working, and she was a human resources director. And I'm like, hey, wait a minute, how'd that happen? She goes, clean and sober for over a year. And I'm like, okay, so you got to tell me how it happened. She said, have you ever heard of a runner's high? And I said, yeah. She goes, well, when I need a hit, I go for a run and I push really hard and I come to the wall. And I know that when I push past that wall, that I'm going to get a rush of endorphins. And she said, it works. So she's addicted to running now. But what do those endorphins do? They relieve anxiety. They relieve depression. They calm your nerves. Gosh, if you can think about all of the medications that people are taking, all these drugs, what do? They calm. They're all things that are sedating. Everybody needs to be sedated. There's a song from the 1980s, and I'm trying to remember. I Want to Be Sedated. I think it was the Ramones. I think I used to say that was the theme song of the nursing home that I was working in, because like everybody wanted to be sedated. Well, you can exercise, and if you exercise enough, something like HIIT, high intensity interval training. You can produce endorphins, and the endorphins will have that calming effect, and you won't need drugs. So I just think exercise is wonderful for all of those things: anxiety, depression, OCD, all of it.
All right. This is good. We have, yep. Brian says, I want to be sedated by the Ramones. You had it right.
I had it right.
Nice. Although I will say, Julie did say Hooked on a Feeling, and that was a pretty good option too.
Oh, that was a pretty good option too.
That might have been before the 80s, I think.
Yeah, it was. Ooga, ooga, ooga.
Yeah. I think of Guardians of the Galaxy as well.
That's awesome. All right, guys. So many fun things you've heard here today, especially that heroin is free on this webinar. That's what I heard. So all of a sudden next week, our numbers are going to jump to the thousands of viewers.
Yeah, there you go.
Oh, this is good. Okay, I'm going to dig into some of these questions here. Let's see. Terry, we were talking about, well, I won't tell you what we're talking about, but Terry said the world is going to hell now. I think that was in reference to the presidential discussion that we were having earlier. So, I won't comment on it, but.
So now other people are really upset and anxious because our president doesn't have all of his mental faculties, right? Yeah. So that's like, really?
Yep.
I've heard a lot of people being very anxious because of that.
Mm-hmm. Okay, so Julie said exercising and losing weight give you more energy, and that's kind of interesting. I was wondering if we could chat a little bit more about the mitochondria. You know, if you're sitting around on the couch and you're tired and you're not wanting to work out, but you really need to work out in order to have actual physical energy. I mean, is it just one of those cycles that you just have to jump in and just make it happen in order? Now, when you say energy, you're saying energy to make different parts of the body work, but also energy to enjoy life a little bit more and to move around at the same time, right?
Yeah. I was talking about the actual physical production or chemical production of energy. But yeah, there's the other one is the mental energy, the I gotta get up and go. Yeah. And I get that, you know, I have a hard time getting up. I actually did my workout this morning, but I've gone for weeks without doing it, going, no, not today.
Yeah. I think we all have. Okay, let me see.
Said neurotransmitters are a hormone. Is that true?
Yeah. Hormones are any chemical that has a distant effect. So it's produced by a gland and it affects other things in other cells. And so that's a hormone. And so the neurotransmitters technically can be hormones too, and very often they are. So things like adrenaline. Adrenaline is a hormone and it's also a neurotransmitter. Norepinephrine is a neurotransmitter and it's a hormone. So yeah, some are exclusively neurotransmitters where they only work in the synapses between the cells, but other ones are secreted by a gland and they act in the synapse of the cells and neurons.
All right, big question here from Anders: is the painting behind me of sheep or flowers?
I said sheep and you said flowers.
Yeah. It's flowers.
Yeah,
it is.
That's a lot.
It's up for your interpretation. It's art, Anders. It's art. All right. Okay. Let me see if I can find some more questions here. Lots of good stuff, you guys. Thank you for chiming in. The Garcias had asked about L-citrulline. Am I saying that right? Citrulline.
Yeah.
Citrulline.
Yeah. Yeah. Okay. So citrulline's amino acid, it's related to arginine, and it's important for making nitric oxide so you can dilate blood vessels. Generally, your body makes enough of it that it's not a big deal. When people were taking a lot of it, for nitric oxide, and nitric oxide helps erectile dysfunction. So for erectile dysfunction, I read one study. They were using like 6 grams of it, so 6,000 milligrams a day was the dose that they were using. So it's a pretty high dose. But what's interesting is Viagra, which is also used for erectile dysfunction. The way it works is to increase nitric oxide. So yeah, that's kind of the same thing.
Interesting. One other thought that just kind of came to me, my sister-in-law and I were both doing Whole30, and we were both really surprised at how good our mental health was even in the first week, just getting rid of the sugar, getting rid of a lot of processed things, that kind of stuff. So just another reminder about the things that we put in our body, not only things we hear, things we see, but the physical things that we put in our body do make a really big difference.
They do. You know, I when I was that idea of I'm gonna like do a diet, and then you discover all the things. I used to eat that. I paid my kids, each one of my kids, $100. I say, I'll give you $100 bill if you'll go for a year without eating any processed sugar, anything with processed sugar in it, because we didn't have any in the house. So if they had any, it was like outside the house, and they agreed. And so that's one of the things they learned. So many years later, they're in college and they're going, you know, I did a whole year without sugar, and I learned about all of that sugar that I was eating. It's really interesting. You learn about what it is by going off it.
Yes, for sure. I've actually been really shocked at some of the things that I've done that I didn't even realize or think about. So okay, so Esther had mentioned the book, The Body Keeps the Score, which we've talked about a few times. In fact, I probably have it down here. Can you tell us a little bit about that book? That might be something of interest to people.
Okay, the idea behind this, The Body Keeps the Score, is that if you have an emotional issue, problem, like adverse childhood experiences, that are eating you up inside, that are emotional problems that you're hiding, or you're blocking, or you're not paying any attention to, your body, they will come out in your body somewhere. And so the body keeps the scores because the body's gonna tell you that something's wrong, even when your brain won't allow you to tell you that there's something wrong. So why do people have back pain, neck pain, migraine headaches, fibromyalgia, and all of those, among many other things, are constriction of blood vessels. So why does that work? Well, this is very well known now. You can actually do thermography and you can see the constriction of blood vessels in the back. If people have back pain, you'd expect it to be inflamed and, enlarged blood vessels, but they're all like, there's poor blood flow there. And so the muscles they're building up lactic acid, they're getting cramps, spasms, and it's like extremely painful, especially if you try to use it because you don't have enough blood flow there. Same with the neck, same with the shoulder, same with whatever. People that have rotator cuff tears, why do they have that? Well, because they don't have any blood flow to repair all the damage that's being done when they're working and doing stuff. So the idea of the body keeps the score is your body's going to tell you when there's something emotionally wrong. And so that's what Dr. Vander Kolk discusses. And he started out with at the VA hospital. So he was working with veterans, and these guys had terrible PTSD, post-traumatic stress disorder from being in a war. You see your buddy's head get blown off, and that never leaves you. And so he was looking at, how do you deal with that? How do you deal with this trauma that people have been through? And then he got out of the VA system and he started looking at outside, and he says, oh my gosh, everybody has trauma. Everybody's been in a car accident or had abuse as a child, or had injury or falls, or whatever, and they're dealing with this trauma, this emotional trauma, and then it's showing up in their body somewhere.
Yes.
Ernest says our body records every emotions and trauma in our life. Here's a book that I have. It's called Finding Victory When Healing Doesn't Happen. These are two counselors who have worked with people with their emotions, and they have a list at the back of what's physically wrong with you could point to certain emotions. For example, here's one that I just randomly chose, a sty, which sty is like when you have a pimple in your eye. They say not seeing the best in other person, unresolved feelings of anger towards someone. So your body, I can't say this is 100% accurate, but it's something to start with or go with when you're dealing with a physical problem and wanting to release it so that your body can heal. But there are tools you can use that help you.
I've used that. I've used that on patients, and it's kind of remarkable when you bring it up and you say, well, this is what the book says is there's some underlying issue going on, like fear, anxiety, or not forgiving somebody or something like that. And they go, oh yeah, well, I do have that problem, and they deal with it, and the problem goes away. So it's a real thing, and I've had that multiple times, so I know it's not just an occasional thing. It's a real thing.
Terry said I had a heart scan that resulted in a high calcium score. I have diabetes as well. Other than diet and exercise, what should I be doing?
Okay, a calcium score and diabetes. Okay, so number one, deal with the diabetes, because if your energy systems don't work, your heart's not going to work right. You're not going to get anything else right. So dealing with the diabetes, get the diabetes solution kit and start on phase 1 and detox from all the sugar and the glucose. Just get all the toxins out of your body. So phase 1 is a detox program. And then once your insulin sensitivity is really good, when your blood sugar is consistently between 70 and 90, then you start working on the other things. So getting rid of the calcium is one thing, but inflammation is the first thing. You got to not clot. So you need omega-3 oils and get rid of omega-6. Go on our discussion from last week and look at, I think we've done this several times, of getting more omega-3 oils and less omega-6 oils. And then you might take an aspirin. Oh, vitamin K was the other one. So vitamin D, vitamin K. So when you're getting synochroma, for example, you're getting both vitamin D and vitamin K. And the reason we add the vitamin K will take calcium deposits from the soft tissues, meaning like in your blood vessels, will take calcium deposits out of the soft tissues and put them into your bones where they belong. So that's how to get calcium out. But if you don't get rid of the inflammation, that's not going to work anyway. So you still have to do the omega-3 and decrease inflammation and find sources of inflammation if you have them.
A question from a Zoom user: does Brilinta actually thin the blood too much? I was told if you cut yourself, there's no way to stop the bleeding. Plus, I'm always getting bruises from I don't know what. Is it possible to get is it possible to get internal bleeding?
Yes. And if you look on Brilinta or all the blood thinners, if you look on their adverse reactions or their potential problems, they all say that you could get internal bleeding from this. And so why are you getting bruising? Well, because blood vessels break. Why do they break? Well, you bump something, or sometimes you don't bump something and they just break. And that happens all over the place. And if it happens in your skin, big deal. It's not going to be a big deal. It'll bleed a little and create a bruise, and then it'll eventually stop bleeding. But so your question of, I've heard that you can't stop bleeding if you're taking Brilinta. Yeah, well, that's what it's for. It's so that you don't make clots. There are other ways. Brilinta isn't the only thing there is, and blood thinners is treating a symptom without treating the problem. So if you look at the problem, why are you getting clots in the first place? It may be that you have a genetic issue. I do. I have something called thrombophilia, a factor V latent. And I did a whole sequence. They have these new gene sequencing. It's called sequencing.com. I send a lot of my patients to that. And you can get all 22,000 of your genes tested. And they look at all of them and they say, okay, these are where you have potential issues. And that was really interesting. So it could be genetic issue that you're clotting more than usual. Inflammation is a big one. So if you have inflammation in your body, you're going to be clotting more than usual. So you got to get rid of the inflammation wherever that's coming from. And then having sufficient amount of omega-3 oils decreases inflammation, prevents you from clotting. You can take extra vitamin E. Vitamin E helps prevent you from having the excess clotting because it's an antioxidant. Garlic also helps, getting garlic in your diet, using fresh garlic. I told somebody that once, and she would take cloves of garlic and she would eat, just chew up a clove of garlic. And she came into my office eating like 3 or 4 of those a day. She came into my office and I go, whoa, do you eat garlic? She goes, oh yeah, I'm eating like 3 cloves of raw garlic a day. And I'm like, okay, good.
Did she also get divorced right after that too? No,
I can tell. So I tried it once. And if you've ever crunched on raw garlic, it is hot, man, it is potent stuff. It was like burning my mouth like crazy. And I eat hot peppers all the time. I love Mexican food, but wow, that garlic was too potent for me.
Wow. Okay. Very, very good. Thank you, Dr. Saunders. You get to go be
You're
with your
welcome.
patients.
Yeah, thank
Thank
you.
you for your time. We'll see you next week.
See you
Those of
next
you
week.
hanging out here, bartonwebinar.com again is our hub. If you use code webinar25, you'll save 25% on anything you find there. Plus you'll get a whole bunch of information about these webinars. Sign up for our other webinars. We do 2 per week, one on type 2 and then one on keeping your heart healthy. You know what? I don't know if we have information on that site about home cures that work, but we definitely should have information there. Check that out too, homecuresthatwork.com. There is a code that you can use. Cheryl, do you know it off the top of your head?
Yes, Home Cures 50.
Home Cures
50 gives you 50% off, 50% off your membership for the year.
That's a big discount. That's pretty awesome. So, and that is just, once you see it, you'll see Dr. Saunders has a lot of articles in there, just really good information that I bet a lot of you will find a lot of value in. So check that out also. And I think that's it for me. Anything else, Cheryl?
I was just going to say, if you love natural health, if you love learning, if you love finding answers that the doctor may not tell you, if you're searching for answers, you might find them at Home Cures at Work. There's almost 14 years of articles on a ton of subjects and written not just by Dr. Saunders, but we've had naturopaths on there. We've had health specialists, researchers, some exercise gurus. Like you'll find something to learn on Home Cures at Work, 100%. So
yes, your little, it's like an at-home library. I love it. It's good. All right, you guys, thanks for hanging out with us for the past hour. We love having you guys here. So many of you are repeat viewers and I feel like you're our friends, even though actually I do know what a lot of you look like. I have actually spoken with a bunch of you on video. So this is fun. Thanks for being here. Tell a friend and come back next week. We'll see you guys.